Good evening, my name is Richard Wells, and this is my professional career plan speech. Choosing a career is often a difficult decision to make. Factors such as yearly salary to overall happiness need to be addressed when choosing a career. For me, that decision was easy. Physical therapy was the obvious choice. It included my interest in learning about the human body and helping others, while also earning a good salary. Those were the main factors that helped me choose this career field, but it was my brother and his wife who really pushed me to pursue this as a career. I was fortunate enough to get an understanding of the career, and not only that, but my brother's wife did my rehab for when I injured my shoulder. Seeing the different career options, how it impacted others, and what the job entailed allowed me to not second guess my decision. There are several paths to choose from in physical therapy, but they all require similar duties and responsibilities. First and foremost, getting the patients the necessary care is top priority. Following an injury or surgery, bones, muscles, and soft tissues undergo a period healing. Failure to use the joint may cause it to heal improperly. A physical therapist needs to know the proper exercises and treatments for certain injuries while also keeping in mind the patient's limitations. This is important because recovery is a gradual process, and you as a practitioner do not want to set your patient back. However, with the correct treatment, patients are able to feel better prior to their injury. Other than being able to assess injuries and develop a training program, physical therapists also need to be able to monitor the progress a patient is making. This is important because what exercises may work for one patient may not work for another. In addition to this, educating your patients on the injury and treatment allows them to understand the recovery process. This is where social skills come into play with this career. One needs to be able to explain to patients what they are doing using terms and concepts that can be understood without watering down the information. For some, this is the hardest part of the job and takes several years of hands-on experience to master. To become a physical therapist, it requires one to get a bachelor's degree with a focus in health and the sciences. These courses include biology, chemistry, physics, and anatomy. Some institutions offer advanced or fast-track programs as well. I would most certainly take advantage if offered the opportunity, because it is very beneficial to have on your resume. After completing a bachelor's degree, one needs to apply to a graduate program to obtain a physical therapy license. Most graduate programs require experience in the field prior to acceptance. Prospective students usually do an internship prior to receiving their bachelor's degree or take a gap year after graduating from their undergraduate program. Upon completion of the graduate program, the last step is getting your license accepted by the state you will be working in. All in all, one can expect about 4 to 7 years to become a physical therapist. While this may seem to be a long time, the satisfaction and benefits you will receive are very worth it. Being a physical therapist allows for much more than a good salary and a comfortable life. It allows one to create and build relationships, improve the quality of lives for others, educate patients, and build compassion for others as well. These benefits are important to me because I was raised to maintain good relationships and to help others. These values help one to understand that not everything you receive needs to have a dollar sign attached to it, but rather, seeing someone you built a relationship with be an entirely new version of themselves. These relationships and the compassion you build for others are largely based upon how well you are able to communicate. While not required for being a successful physical therapist, communication plays an important role in this career. You need to be able to communicate with your patients about exercises, progress, and injuries, with allowing the patient to understand. As the quote-unquote source of a message, you need to put a message into a code that can be understood by a receiver. While not being a requirement, we can see how communication plays an important role in physical therapy. Thank you very much for listening. Have a great night.